Hello everyone, my name is Biju, one of the MS and FNP student for Chamberlain University. Today I will be recording this physical assessment video for my NR 509. Before starting the video, I'm gonna go ahead and do a quick scan of my room. Okay, now I'm gonna go ahead and adjust my camera. Okay, here we go. I have Krishna with me. Krishna is gonna go ahead and give me the permission to record the video for Chamberlain University.
Hi, my name is Krishna and I give a permission to record a video for the Chamberlain University.
Thank you, Krishna. So while I'm starting my physical assessment, I'm going to go ahead and start with the head. Inspecting the head, there are no any obvious deformities that I can see in his head. Head is symmetrical in the shape, and there are no any wound or any skin openings in his head. So after the inspection, I'm going to go ahead and palpating his head from front and to the back. So while I'm palpating his head, I could not find any abnormal bony structures or any deformities in his head. And his head is symmetrical in shape, in the shape, which is normal. After the head, I'm going to be moving into his ear. Both of the ear on his left and right side are equal in the shape. I'm gonna go ahead and palpate the external ear canal. There are no any obvious deformities that I could see. Skin is pink in color. There are no any abnormal discharges that I could see from the external ear. While I'm in the ear, I'm gonna go ahead and test his cranial nerve number 8, which is acoustic nerve. For that, I'm gonna be performing a whisper test.
1, 2, 3, 4.
Okay, same thing on the left side.
1, 2, 3, 4.
His cranial nerve number 8 is normal and intact. So after the assessment of the ear, I'm gonna be doing inspection with this otoscope. I'm gonna be checking if he has any redness or any drainage or any abnormal structure inside both of his ears. Starting with the right ear, I'm gonna go ahead and pull the spina down and towards me. His internal ear canal is clean and clear. There are no redness or any discharges. And moving on to the left side, his internal ear canal is clean and dry, and tympanic membrane is pure color, and there are no any secretions I could see. So while I'm in the ear, I'm gonna go ahead and palpate his two lymph nodes, which is pre-auricular at the in front of the ear and post-auricular is at the back of the ear. Both of the lymph nodes are not palpable. He is not hurting while I'm palpating them. That means they are normal. So after the ear, I'm gonna be moving into his eyes. His eyes are normal in the shape. I do not see any swelling or redness on the external structure of the eye. Sclera is wide, which is normal. While I'm in the eyes, I'm gonna be doing optic nerve assessment, which is cranial nerve number 2. For that, I'm gonna be using this Snellen pocket chart. For that, I'm gonna go ahead and stand 20 feet away from Chris, and he's gonna read me the smallest number, the lowest number possible he can. Chris, I want you to go ahead and close your left eye. So with your right eye, can you please go ahead and read the lowest number possible? Sorry, lowest word possible.
L, T, F, P, H.
Thank you. So accordingly, with your right eye, yeah, I want you to go ahead and close your right eye, and with your left, can you please go ahead and read the smallest word possible?
L, T, F, P, H.
Thank you. So the vision on his right and left eye is intact, which is 20 by 20. After the vision, optic nerve 2 is intact. Cranial nerve number 2, which is optic nerve, it is intact. Now I'm gonna go ahead and assess cranial nerve number 3, 4, and 5. Cranial nerve number 3 is oculomotor, 4 is trochlear, and 5 is abducens muscle. For that, I'm gonna go ahead and move my finger in the H pattern, and I'll see how his eyes will follow my finger. Okay, so cranial nerve nerve number 3, 4, and 5 are intact as well in his eyes. So after the eyes, I'm gonna go ahead and moving forward to his nose. His nose is symmetrical in the structure midline in between both the eyes. There are no any obvious excoriation or any external discharge I can see from his nose. While I'm on his nose, I'm gonna be palpating his sinuses, his maxillary sinus. Both of the sinuses are not palpable. That means, and they are not red either. That means they are normal. So after assessing the external structure, I'm going to be inspecting the internal structure to see if he has any polyps or any abnormal structures inside his right and left nose. Starting with the right. So right nose is clean and dry. There are no polyps that I can see on his right nose. Accordingly, with the left one too, left internal nasal canal is clean and dry, no secretions or no drainage or no polyp, and his nasal septum is in the midline. So after the nose, I'm going to be moving into his mouth. With the mouth, while I'm assessing his mouth, his lips are pink in color. There are no any obvious deformities I can see in the structure of the mouth either. The skin is pink, mucosa is moist and dry. While I'm in his face, I'm in his mouth, I'm gonna go ahead and assess cranial nerve number 5, which is trigeminal nerve. Chris, can you clench your jaw? So while his face is normal on the structure while he's clenching the jaw. So after that, I'm gonna go ahead and do the sensation test for the nerves for trigeminal nerve. For that, Chris, I want you to go ahead and close your eyes and tell me where you can feel my finger.
Forehead, nose, chin, left cheek, right cheek.
Okay, so trigeminal nerve is normal and intact in the face. After that, I'm gonna be moving on to cranial nerve number 7, which is where I'm gonna be inspecting his smile, which is in the face as well. Can you go ahead and smile for me? Raise your eyebrows. Okay, so cranial nerve number 7 is intact as well. Cranial nerve number 8 is a glossopharyngeal nerve, which is a gag reflex, which is for gag reflex, which we will not be doing in the physical assessment today. And after that, I'm gonna be moving into inspecting his mouth. Inside the mouth, can you please open your mouth? Okay. So while I'm assessing his mouth, there are no any abnormal structure I could see. There are no dental decays. Buccal mucosa are pink in color, and the tongue is pink as well. And after that, I'm gonna be assessing cranial nerve number 10, which is vagus nerve. For that, I'm gonna go ahead and ask him to make a sound ah, and I'm gonna be seeing the symmetrical rise of the uvula while he's making the sound. Can you go ahead and say ah? So uvula is rising equally and symmetrically, which is normal. That means his vagus nerve is intact as well. So after that, while I'm in his mouth, I'm gonna go ahead and palpate his mandibular lymph node, submandibular lymph node that is underneath his jaw, which is not palpable. That means it is normal. So after that, I'm gonna be moving into his neck. Neck, I'm gonna be starting with the inspection assessment of the neck. There are no any abnormal structure I could see. His skin is normal. There are no opening, no wounds or anything around his neck area, and the neck is in the midline and symmetrical in the structure as well. While I'm in the neck, I'm gonna go ahead and palpate the carotid artery on both sides of his neck. And it does have normal brood while I'm palpating. And for that, I'm gonna go ahead and use the bail of my stethoscope, and I'm gonna go ahead and auscultate the brood as well. On the right side of the neck, the brood is normal, and I'm gonna be doing on the left side of the neck as well. And the brood of the carotid artery is normal. So after inspecting and palpating carotid artery, I'm going to be moving on to palpating the trachea, which is in the midline. And there are no any other structure I could find around the trachea. That means they are normal. And after that, I'm gonna go ahead and assess his cervical lymph nodes on the both side of his neck. And palpating his cervical lymph node, I couldn't palpate the cervical lymph node. That means they are normal. They are not inflamed, and they are normal. So after that, I'm gonna be moving into the range of motion of his neck. With the flexion, Chris, can you flex your neck onto your left side? Can you flex your neck onto your right side? Can you flex backward? Flex front? Can you rotate your neck? Okay, so all the range of motion are intact in his neck. So after the neck, I'm gonna be moving onto the shoulder. His both of the upper shoulders are symmetrical in shape and size. And while I'm in the shoulder, I'm gonna be assessing his cranial nerve number 11 for his spinal accessories. For that, I'm gonna go ahead and put my hand on both of his shoulders, and he's gonna push it up. Okay, so his spinal accessories muscles are intact on there. After then, I'm gonna go ahead and move on to his upper extremities. Upper extremities, while I'm assessing his skin, there are no any skin abnormalities. Skin integrity looks great. There are no any obvious polyps or any skin opening that I could see. And then after, while I'm in the upper extremities, I'm gonna go ahead and check his capillary refill. Capillary refill is less than 3, which is normal. And I'm gonna go ahead and take his radial pulse while I am assessing his upper extremities. Okay, radial pulse is normal as well. So after that, I'm gonna be checking the strength of his both upper extremities. For that, Chris, can you please hold my hand and squeeze it as much as you can? Okay, the strength on both upper extremities are 5 out of 5, which is normal. After then, I'm gonna go ahead and check the strength of his biceps and triceps muscles. For that, I want you to go ahead and face towards the palm facing towards the face, and I'm gonna go ahead and pull him, and here I'm gonna go ahead and pull him towards me, and he's gonna pull me towards him. So the strength of the biceps and triceps are equal as well. So after then, I'm gonna be moving forward and assessing the joints to see if they have any redness or inflammation. Elbow joint is completely normal, and all the joint on his upper extremities are, there are no redness or no inflammation I could see on his upper extremity. While I'm on the upper extremity, I'm gonna be on the right side, and I'm gonna go ahead and do extension and flexion of his elbow. Passive extension and passive flexion, which is normal. And then after, while I am taking his extension and flexion, I'm gonna be using my hammer, and I'm gonna go ahead and take his deep tendon reflexes. For that, I'm gonna go ahead and put his hand onto my hand, and I'm gonna go ahead and put this hammer in between his antecubital fossa to see if he has any reflexes. And his reflexes are intact on this side. So after that, I'm gonna be moving onto the shoulder. For the shoulder, I'm gonna be starting with internal rotation, external rotation, abduction, adduction. So all the passive range of motion on his right shoulder are normal as well. So after that, I'm gonna be moving onto his chest. While I'm inspecting his chest, both of the right and left chest are raising equally, and he is breathing normally. There is no on labor breathing I can see while I'm assessing his chest. So while I'm in his chest, I'm gonna go ahead and listen to the heart sound. For that, I'm going to be using my diaphragm, and then after bell of my stethoscope. I'm going to start with the diaphragm at the beginning, and then after I'll move on to the bell on my next step. Okay, starting with the second intercostal muscle, which is aortic valve on the right side. Okay, Second intercostal muscle on the left side is pulmonic valve. Third intercostal muscle, Erb's point. Fourth intercostal muscle is tricuspid valve on the left side. In fifth intercostal muscle is mitral valve. There are no any obvious murmur or any abnormal heart sound I could hear. So respectively, I'm going to be using bell of my stethoscope, and then I'm going to go ahead and listen to his heart sound one more time, starting from the right side. Second intercostal muscle on the right side, which is aortic valve. It's normal. The sound is normal. Second intercostal muscle on the left side, which is pulmonic valve. Third intercostal muscles on the left side is Erb's point. Fourth intercostal muscle is tricuspid valve. And fifth intercostal muscle is mitral valve. So there are no any abnormal murmur or any abnormal heart sound I can listen while I'm listening to his heart. So respectively, I'm going to go ahead and listen to his chest. I'm going to start with the anterior chest. Can you take a deep breath in and out? Thank you. Deep breath in and out. Thank you. Deep breath in and out. 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 Thank you. So there are no any abnormal adventitious breath sounds or any wheezing or any other abnormal lung sound in his anterior lung. So respectively, I'm going to be moving on to the posterior side of the lung. Okay, Chris, I want you to move this way and face exactly the back. Okay, so this way I'm going to be starting from the clavicle bone. Can you take a deep breath in and out? So, same way on the posterior side of the lungs as well, there are no any other abnormal breath sound I could hear. So from the heart and lung, I'm gonna be moving onto the abdomen. For that, I'm gonna go ahead and lay him in the supine position and doing some abdominal examination as well. Okay, Chris, I want you to lay down. Okay. So while I'm gonna go ahead and expose his abdomen only. So while I'm assessing his abdomen is symmetrical in the shape and size. And then after there are no any abnormal size that I could see while I'm seeing his abdomen this way. It's round in the size shape as well. So after that, after the inspection, I'm gonna go ahead and auscultate the breath. Abdominal valve sounds on all the four quadrants on right and left side. Okay, starting on the right upper. Right lower. Left upper. Left lower. There are no any abnormal valve sounds anywhere. Normal valve sounds I can hear on the all four quadrants of his abdomen. So after that, I'm gonna go ahead and percuss his abdomen to see if he has any fluid or anything collected into his body. For that, I'm gonna be using third of my finger. And on the progression as well, I could not hear any abnormal fluid collection or anything in his abdomen. After the progression, I'm gonna go ahead and palpate his abdomen and see if I can find any abnormal mass or any abnormal structure in there. So palpation, I cannot find any abnormal structure in his abdomen, which is normal. So while I'm palpating his abdomen, I'm on the right side of the abdomen. I'm gonna go ahead and put my left hand underneath it, costovertebral angle, and I'm gonna go ahead and palpate his liver on the right side. His liver is not palpable on the costovertebral angle, which means that is normal. And respectively, I'm gonna go ahead and palpate. Chris, can you turn a little bit on this side? Palpate his spleen on the left side. So spleen is not palpable. That means the spleen is not inflamed or there are no any infection on the spleen, which is normal. Okay, you can go ahead and lay back. And after that, I'm gonna go ahead and assess for Bomberg sign to see if he's hurting anywhere on the 90-degree angle in here. So the sign is negative. There is no pain while I'm pressing his abdomen in the 90-degree angle with my right hand. So after the abdomen, I'm gonna go ahead and move on to his lower extremities. For that, while I'm assessing his lower extremities, the skin color is clean and dry. There are no obvious skin deformities I can see on his lower extremities. I'm gonna go ahead and adjust the camera a little bit this way. Okay, so there are no any skin discoloration or any other skin structure that I could see while I'm inspecting his both of the lower extremities. And then after, there are no swelling on the joints. Knee joints are fine, and ankle is completely okay as well. So while I'm on the lower extremities, I'm gonna go ahead and do his passive range of motion for his right knee. Flexion, extension, flexion, extension. So passive range of motion is intact. While I'm on his lower extremities, I'm gonna go ahead and palpate his dorsalis pedis. The dorsalis pedis are palpable equally and they are normal. And after that, I'm gonna go ahead and do the passive range of motion exercise for this ankle. Chris, I want you to go ahead and flex your knee, flex your ankle, and then after extension. Okay, this is normal. And can you please move your ankle? Okay, so the movement is normal as well. And after that, I'm gonna be moving on to his hip. For that, I'm gonna go ahead and flex his knee, and then after I'm gonna go ahead and do the abduction, adduction, flexion, extension. So the range of motion on his hip is intact as well. And after I'm done with his lower extremities, I'm sorry, I'm not done yet. I forgot to take the deep tendon reflexes on his knee. For that, I'm gonna go ahead and hold his knee, and I'm gonna be using this hammer and see if his deep tendon reflexes are normal or not. So deep tendon reflexes is normal on his lower extremities as well. So after then, while I'm done with the lower extremities, I'm gonna go ahead and examine his spine. For that, I'm gonna go ahead and make him to be up. Chris, can you get up? And then after, be up and turn towards the camera on the back side. So for the spinal assessment, I'm gonna go ahead and assess his back. on the spine. So there are no obvious deformities or any obvious skin structural deformity I could see. And while I'm palpating his spine as well, there is nothing I can find abnormal wise. So his spine looks completely normal. So to see the range of motion of his spine, I'm gonna go ahead and ask him to place downward and backward. So Chris, can you go ahead and touch your feet? Thank you. And can you go ahead and come backward? Okay. So and then after, can you go onto the side and come towards me on the side? Okay. Thank you. So all the range of motion on his spine is normal as well. So after the spinal assessment, I'm gonna go ahead and do the assessment of the gait. So for that, I'm gonna ask him to walk a couple of steps. Okay, so the gait and the balance is normal as well. Chris, can you just go ahead and sit? While I was doing my assessment earlier, I forgot to see the cerebral coordination, which is by counting the finger. Chris, can you just go ahead and count the finger? And try to do it as much as possible. Thank you. So while he can do it faster, that means his cerebral coordination is normal. By this, I'm gonna go ahead and conclude my physical assessment video NR 509. Thank you.